Hi from Stefano Verona, Simple Psychology. I decided to make this video because I constantly find that people who don't work in the field of addiction have a hard time understanding the mental state of someone with this disorder. If you're not satisfied with explanations like, they're weak, they're spoiled, or they lack willpower, stay tuned to this video until the end. I'll use an example that will hopefully help you. I want you to try to imagine what would happen if tomorrow you were offered a job that paid 4 to 5 times what you're currently earning. You would be filled with enthusiasm and euphoria. You would start to see this opportunity as a great chance, since you would feel like you could use that money to achieve a whole range of things that you couldn't afford yesterday. You would also be convinced that a whole series of problems and financial worries would disappear. Let's try to imagine that you decide to take this opportunity. The job is extremely demanding but very well paid. Over time, you see that your life has changed a lot. You have nicer things, a bigger TV, and you've probably changed your car. You go on vacation to amazing places and meet new people. However, you realize that you have much less free time for yourself, since this job keeps you busy until late at night. You don't have time for your family anymore. You missed your daughter's dance performance, and you can't watch your son's soccer practice. Even if you take vacations to wonderful places during the year, you don't have time to spend with the people you love. You're much more stressed, you get easily irritated, and you don't have time to read or go for walks. Your life is gradually getting worse. At this point, you might consider giving up this very well-paying job to regain those things that gave your life quality. You could thus find your free time and serenity, but it seems impossible to go back. You have an expensive car to maintain, a high rent, and many other expenses that you didn't have before. Let's try to imagine that you really have the courage to leave this job because you've realized that it doesn't make sense to earn so much if your life is getting worse day by day. You've realized that you're not happy to have objects or services of value if this compromises what can really give you quality of life, your time and your relationships. Leaving that job, however, would involve a whole series of difficulties. You certainly won't have the money to pay off the car loan, so you might have to sell it. You would also have to move to a smaller house and stop giving your family so many nice things. All of this would require a lot of effort and sacrifice. Some people have the courage to make this extremely courageous choice, but you can imagine that they are very few. If we were to divide this story into different phases, we could call the first phase, the euphoria of initial well-being, the pre-contemplative phase. This is a phase in which the person enjoys all the benefits of a change but has not yet realized all the negative consequences of their choice. We will call the contemplative phase, on the other hand, the phase in which the subject begins to question their new lifestyle. They ask themselves questions and wonder if their life has really improved or deteriorated. This is what we will call the contemplative phase. Then there was the determination phase, in which the decision is made to leave the job that is compromising quality of life. It is an extremely important phase, because it leads to the next phase, which is the action phase. Here the subject begins to face the consequences of their choice. They move back into a more modest house, change cars, and generally modify their lifestyle again to return to a state of greater mental health and inner peace. What does all this have to do with addiction? Perhaps some of you have already guessed, but this is exactly the situation that a person who is addicted to a substance experiences. In the example I gave you, I told you about a person who is addicted to a boss who pays him very well, but now let's talk about people who are addicted to substances or behaviors. When a person experiences a psychoactive substance or an addictive behavior for the first time, think of heroin and gambling, for example, they experience very strong feelings of inner well-being. Initially, they get involved in this type of experience and enjoy all the physical and emotional benefits that this experience can give them. In this first phase that we called pre-contemplative, the subject does not question themselves. They don't ask themselves what the price is of all that initial well-being and don't accept advice from people who would want to keep them away from that choice. In the case of substances, sometimes it is spoken of as a phase of falling in love. Subsequently, inevitably, problems, legal, health, relational, economic, etc., begin to arise, which are the price that is inevitably paid when a dependence develops. In this phase, the brain strongly resists change because it would mean giving up the pleasant sensations, relaxation, well-being, anesthesia, excitement, euphoria, enthusiasm, depending on the substance or behavior, exactly like that person who cannot accept the idea of going back to their old salary. It is possible that the drug addict decides to abandon their new life. We will say that they are in a phase of determination. If they can maintain it, they will pass to the phase of action and will have to face all the consequences of this change. They will have to give up a substance or behavior that gives them momentary well-being, balance, strength, serenity, or other sensations to which they have become accustomed. They will have to radically change their lifestyle, to go towards an absolutely uncertain condition that certainly scares them a lot. We who work with people with addictions sometimes have to take them from a pre-contemplative phase, when they come to us pushed by their families, to a contemplative phase. To do this, we use linguistic and communication techniques to accompany them to a phase of contemplation. When they have assessed their current lifestyle, we will have to lead them to a phase of determination to change, guaranteeing them support to face the phase of action. In this last difficult part of the treatment, the patient will have to be able to adapt to a condition in which they will have to face a difficult phase of adaptation. Often they will not even return to the condition before the onset of the disorder, as they will have to face the consequences of the damage they have caused to their life up to that point. Loss of friends, money, loved ones, work, debts, etc. But this is not the condition of everyone. In the previous example, we could compare it to someone who, by leaving the new job, will find themselves facing heavy losses but has a certain certainty of being able to recover what they have lost if they stop their abusive behaviors. However, there are some people who come from a situation of deep psychological suffering that, in the previous example, are comparable to people who, instead of coming from a condition of reasonable economic well-being, lived in a condition of absolute poverty. For those who, for example, experience alcohol or heroin coming from a situation of strong emotional and affective deprivation, or in general of very significant psychological suffering, thinking of stopping using it would mean plunging back into a condition of enormous suffering from which they found relief, thanks to those substances. Treating a patient during the phase of action does not always consist in helping them to regain their previous state of equilibrium. Often it is necessary to heal their wounds that had found momentary relief precisely thanks to those substances. Only in this way will they be truly available to abandon those self-destructive behaviors. For this reason, it is important that an entire team of professionals take care of the patient. The doctor will promote a painless detoxification and, through drugs, will help them to find an optimal psychophysical balance. The psychologist will heal the patient's emotional wounds. The educator will teach them how to face the new condition of life in the best way possible. Social assistants will facilitate their reintegration into society, helping them to solve various problems such as those relating to housing and work. The cure necessarily involves passing through a new phase of imbalance that is, however, aimed at restoring a healthy and harmonious life.